Thailand has been affected by HIV/AIDS for almost 3 decades, with the first cases identified in 1984. But even though the number of new infections has marginally decreased over the past few years, stigma, prejudice, and discrimination against people living with HIV still remains a serious problem, especially among sex workers, the homeless, men who have sex with men, and drug users. AIDS activists have worked hard to encourage members of the public to stop discrimination against people living with HIV, but the stigma continues to haunt all HIV-positive people, especially the poor. The homeless, in particular, are unable to get a bed in a state hospital after they become infected and start developing symptoms. Although hospitals are required by law to treat HIV-infected people under the Universal Healthcare Scheme, they often push them out of the facility as soon as possible.
คือมันนอนทอดอะไรอยู่ที่ข้างถนน
We found one HIV-infected patient who simply laid down beside the road and was dead a month later. Would he have died if medical workers had tried their best to save him and paid attention to providing treatment to him? Most HIV/AIDS patients, especially those who are homeless or sex workers, are given only basic medical treatment from healthcare units. According to the Isarachon Foundation, this year alone, at least 8 homeless people in Bangkok's Sanam Luang area have died of AIDS.
บริการทางการแพทย์
have a lot of laws, such as the National Health Act and the National Health Security Act, which allow all Thais to access medical treatment at any state hospital. But in reality, things are not like that. Hospitals still refuse to provide treatment to patients who are homeless. They still stigmatize and discriminate against people living with HIV. The same discrimination applies to sex workers too. Empower Foundation, which promotes welfare for sex workers, has found that many sex workers have been abused by state officials and medical workers. They have not been treated very well while undergoing treatment at hospitals. Police and medical workers always look down on sex workers whenever they go to a police station or a healthcare unit to seek help. However, when looking at HIV prevention among sex workers, the foundation found that many sex workers now know how to refuse customers if they do not use condom. We have been taught to use a condom every time and have learned to say no sex outside our workplace. A survey conducted in 2012 showed that up to 90% of Thai sex workers were using condoms. The Public Health Ministry estimates that more than 1 million people have been infected over the past 2 decades, and only about 464,000 of them are still alive. The key reasons for this increase are that many people still indulge in unsafe sex and not many undergo tests. About 62% of those infected with the HIV virus are men who have sex with men, sex workers, and drug users.